Welcome to my YouTube channel. Today's topic is stroke, one of the major cause of death. What is stroke? According to the World Health Organization, a stroke is defined as an accident to the brain with rapidly developing clinical sign of focal or global disturbance to cerebral function, with symptoms lasting 24 hours or longer, or leading to death, with no apparent cause other than of vascular origin, and includes cerebral infarction, intracerebral hemorrhage, and subarachnoid hemorrhage. Acute stroke. Acute stroke is also commonly called a cerebrovascular accident, which is not a term preferred by most stroke neurologists. Stroke is not an accident. The better and more meaningful term is brain attack, similar in significance to heart attack. Types. The common type is an ischemic stroke caused by interruption of blood flow to a certain area of the brain. Ischemic stroke accounts for 85% of all stroke. According to the TOAST classification, there are four main types of ischemic stroke. There are large vessel atherosclerosis, small vessel diseases, cardioembolic strokes, cryptogenic strokes, hemorrhagic strokes, which are caused by bursting of a blood vessel, i.e. acute hemorrhage. There are two main types of hemorrhagic strokes: intracerebral hemorrhage and subarachnoid hemorrhage, which accounts for about 85% of all strokes. Regardless of the types of stroke, it is important to note that with each minute of large vessel ischemic stroke untreated, close to 2 million neurons die. Is it a stroke? What you think about what is fast? When you are facing face drop, arm weakness, and speech difficulty, now it's time to call ambulance. If someone facing stroke. According to the World Health Organization, 15 million people suffer stroke worldwide each year. Of these, 5 million die and another 5 million are left temporarily disabled. Hemiplegic stroke. Hemiplegia is paralysis of the muscles of the lower face, arm, and leg on one side of the body. In addition to motor problems, other losses may occur. Example given: sensation, memory, cognition. The most common cause of hemiplegia is stroke, which damages the corticospinal tract in one hemisphere of the brain. What are the symptoms of a stroke? The symptoms of stroke can involve one or more of the following: one-sided weakness or paralysis, aphasia, difficulty with or loss of speaking ability, slurred or garbled speaking, dysarthria, loss of muscle control on one side of your face, sudden loss either partial or total, blurred or double vision, diplopia, loss of coordination or clumsiness, ataxia, dizziness or vertigo, nausea and vomiting, neck stiffness, emotional instability and personal changes, confusion or agitation, seizures, memory loss, amnesia, headache, passing out or fainting, and coma. Transient ischemic attack (TIA). A transient ischemic attack, sometimes called a mini stroke, is like a stroke, but the effects are temporarily. These are often warning signs that a person has a very high risk of having a true stroke in the near future. Because of that, a person who has a TIA needs emergency medical care as soon as possible. What causes a stroke? Atherosclerosis, clotting disorders, atrial fibrillation, especially when it happens due to sleep apnea, heart defects, atrial septal defect or ventricular septal defect, microvascular ischemic disease, which can block smaller vessels in your brain. Hemorrhagic stroke can happen for several reasons, including high blood pressure, especially when you have it for a long time when it's very high, or both. Brain aneurysms can sometimes lead to hemorrhagic strokes. Brain tumors, Disease that weaken or cause unusual changes in blood vessels in your brain, such as Haemorrhage disease. Several other conditions and factors can contribute to a person's stroke risk. These include alcohol use disorders, high blood pressure, high cholesterol, hyperlipidemia, migraine headaches, type 2 diabetes mellitus, smoking and other form of tobacco use, drug misuses including prescription and non-prescribed drugs. What test will be done to diagnose this condition? Following tests will be performed to diagnose stroke: carotid ultrasound, blood test, CT, MRI, cerebral angiography, carotid ultrasounds, and echocardiograms. Treatment options for stroke patient. First of all, pharmacological management or treatment. Second is physiotherapy. Third is speech therapy. And fourth is occupational therapy. Recovery from a stroke. People who survive a stroke are often left with long-term problems caused by injury to their brain. Some people need a long period of rehabilitation before they can recover their former independence, while many never fully recover and needed ongoing support after their stroke. Local authorities should provide free rehabilitation services for any assessed as needing them. These services help the person to recovering from a stroke learn and relearn the skills they need to live at home independently and perform their function independently. So the recovery from stroke is depend on the rehabilitation. What are the complications of untreated stroke? Permanently paralyzed, long-term dependency, seizures, contractures, reoccurrence of attack, DVT, deep vein thrombosis, loss of speech.